The Saskatchewan NDP is accusing the province of being slow in implementing enhanced security measures at Saskatchewan's hospitals. The NDP says the 2024-25 Ministry of Health annual report found that violent incidents had doubled over a two-year period. The opposition says 23 criminal acts were committed against patients, yet the government failed to install emergency room metal detectors until this month. The government is blaming a security review, but the NDP feel action is needed now. Meara Conway is the NDP's health critic and joins me in studio this morning. Meara, thanks for spending some time with us.
Absolutely.
Those numbers are startling. What do they say to you?
Yeah, and those numbers are only violence on patients. That doesn't actually capture the violence that's happening towards staff. So very disturbing. And we see that the government announced last week that they were going to install metal detectors and do a review, but no details around the scope or timeline or details of that review. So what we highlighted yesterday is we learned that actually metal detectors were suggested in a auditor report years ago. We saw that report point out that the government's current approach, which was just a policy against weapons, would be totally ineffective. It spoke about the need for something further, such as pat-downs, metal detectors, and no action was taken until, hundreds of workers spoke out, healthcare workers, and then, of course, a tragedy in Saskatoon. So our point here is that, this government continues to be completely reactive in the face of these crises.
So what do we do differently? If you were in power, what would you do?
So we see these reviews done, we see recommendations come out, and then we just see them sit there. This auditor's report spoke to about 10 recommendations, almost none of which have been fully implemented now several years later. We need to act quickly when we do these kinds of analyses. We need to act on what they tell us. We need to address root causes too. We know that these emergency rooms are understaffed. People are hanging on by a thread, healthcare workers. We know that the social issues that are spilling into these ERs are just getting worse. We warned this government when they made changes to housing and social assistance, and that the lack of mental health and addiction help would make things worse, and they are.
Are you able to have productive conversations across the aisle to work together with the government on this?
I really wish I could say that I can. There isn't a lot of working together, unfortunately.
How much of this is on the government? How much is it on the people? Like, my goodness, like, people, control yourselves.
Yeah.
Right? At some point, it's us.
I mean, I think that it's twofold. People usually go to the emergency room in a crisis. They go when they're facing some of the worst moments in their life, and they learn that the healthcare that they expect isn't always there. And that's taken out on frontline healthcare workers, and that's not fair, but that's the reality. So we need to address that. The other thing that's happening, as I said, this social distress, and there's many reasons for that, whether it's homelessness, whether it's mental health. And I do believe that these frontline healthcare workers, they took an oath, they take their duties seriously, which is why they're speaking out, which is why they're so distressed that they can't provide that care. So I think we need to create conditions for things to improve. Individual blame, I mean, there are certainly situations where people are stepping out of line and they need to be held accountable, but these are also systemic issues that need to be addressed as such, and that's on government.
Why, you mentioned off the top that that's only crimes and altercations with patients.
Yeah, that has to do with the auditor's mandate.
What about doctors and nurses and things like that? Why is that not tracked?
I don't know. I've spoken to a lot of frontline healthcare providers. They feel often that their concerns aren't taken seriously. Sometimes they feel like they're not encouraged to, say, speak to police about assaults and such. I saw that Sun has come out and really encouraged their membership. If you're assaulted on the job, you should be pursuing that. Yeah, it's really sad. Like, this is very common. This has been a crisis building over years, and I think it's just too bad that it took a tragedy and this totally historical event, to be frank, of these healthcare workers speaking out en masse for this government to put in place a recommendation they actually had years ago. That's the big fix. It's disappointing.
Meara, thank you for your time this morning. We did reach out to the government, and we will try to have Jeremy Cockrell on the show as well.
Thank you.